In this video, I'm going to walk you through the 3.2 research checkpoint, where you will choose a topic and form questions to help guide your research. So that's our objective. We're going to complete these steps as you watch the instructional video to select a topic and generate questions. And remember that this research checkpoint is your mastery check. So this is what you're turning in as your mastery check for this lesson. I am going to talk through each of these questions and also give you a model based on a social issue that is personally meaningful for me. So you can either watch through the whole video so you have an example, or you can pause after each little bit that you need to go do your own part. Whatever way works best for you. I'm also going to have this model posted on Google Classroom for you to refer to. So the first step is going to be to select a topic. What social issue are you going to research and propose a solution for? So in Google Classroom and on the wall right next to the screen is the brainstorm, where we brainstormed a bunch of social issues that you guys might be interested in that you can choose from. I'm also going to show you a way to use AI to help generate some ideas for you. So first thing is take a look at that brainstorm we've already done, and then we can also take a look at AI. So remember, we are picking a social issue, something that affects individuals as well as society as a bigger group. And not something that you're just interested in. So, for example, you can pick something that you are interested in, like a topic that you are just interested in, and then find a social issue within that topic. So, for example, I know some of you guys are interested in football, so we can put in the question, what are some social issues related to football, into ChatGPT, and it's going to give us all of these different facets of football related to social issues. So, you've got a whole bunch here, 10 different social issues related to football that you might be able to pursue for this project. So pop in whatever topic you are interested in, what are social issues related to whatever your topic is, and then hit the little arrow and see what ChatGPT comes up with. That is an option for you. All right, so the social issue that is personally meaningful to me is access to mental health care services. So starting last summer, my older child is about to be 14. They started experiencing some mental health issues that have really had an impact on themselves as well as our family. So this is something personally meaningful to me. Make sure you pick something that you actually care about, that you want to propose a solution to, because we're going to be spending about 7 weeks on this, and it's going to be a slog if it's something you don't care about. That's the beauty of this project, is you can pick whatever you're interested in to pursue. This is a national issue because this affects people all over the U.S. It's not international because it's not something that affects relations between two countries. It is a global issue in that people all over the world are impacted, but this isn't something that we need to work together with people all over the world to solve. So it is a national issue. After I have selected my topic, the next thing is to form my research question. So first is the central research question. It's the big question. Before we do that, we need to make sure we have an understanding of the background or the context of the issue so we can narrow our focus. And make sure we're pursuing something that we know something about and that can be researchable. So the first thing is, what are the root causes of the issue? What has caused this issue to be a social issue? So first of all is stigma around mental health issues. If my child had been diagnosed with cancer last summer, we would have gotten a much different response from people than them being diagnosed with a mental health issue. Our families have been very supportive, but there still is a stigma. I still don't feel super comfortable sharing details, whereas if this was a physical health issue, I would feel more comfortable. A lack of funding for mental health issues versus physical health issues, especially as far as research goes. Mental health care professionals shortages. So an issue that we have come into contact with is how long it's taking my child to be seen by a doctor in mental health care field. Whereas if I was trying to make an appointment with their pediatrician, I could get an appointment that day or the next day. Even with a specialist, it doesn't take that long to be seen by a physical healthcare provider, but there's a shortage of professionals in the mental health field, and so it's taking longer for them to be seen. And then limited insurance coverage. The effects of the issue and how does it affect people or systems. If mental health issues go untreated, that just makes the mental health issue get worse. It also has an impact on physical health. So you can have physical health symptoms as a result of mental health issues. A lower quality of life in general, so just not wanting to do things, interpersonal conflict, and that kind of thing. There's an impact on education or work, so not being motivated to do schoolwork, not wanting to go to school, those kinds of things. And then family strain. There's definitely been an increase in conflict between my child and other members in our family because of their issues. Next is who are the stakeholders? So who is affected and how are they affected? Remember, these are people who are like the victims of whatever this social issue is, as well as people who are wanting to do something about it, and you yourself, since you were researching this. So of course, the first who is affected is the individual who needs mental health care, and then outside of that immediate circle is their family and friends. The healthcare providers who are providing services, insurance companies, and then community-based organizations who are doing something to help. Next is to think about who I might propose my solution to. So who is an authentic audience that I might be able to share my solution with in order to help fix the problem. So community-based organizations might be able to provide funding, provide resources like therapies, like support groups, that kind of thing. And then also government-based agencies. So this could be at the state level or national level or even local level. Solutions that have already been attempted and who is already trying to solve the problem. So there are telehealth services. You can call somebody on the phone, have a Zoom appointment, awareness campaigns to reduce the stigma, so trying to make mental health issues more acceptable socially, and then state initiatives to increase funding. I assume national initiatives to increase funding would be up there as well. Even with these solutions in place, what are some gaps or challenges that still exist? So like I mentioned before, the lack of in-person providers. My child prefers to see doctors in person, see therapists in person, and there are just not enough people that have appointments available. And then insurance limitations. So even with the providers who are available, there are only like so many therapy appointments that my child can go to before insurance won't cover it anymore. Once I have a good understanding of the topic, good understanding of the context, I'm going to form my central research question. So this is like the big question that all of my guided questions are going to help support and answer. And we've got this template that you can use here. How can whatever your specific social issue is be addressed to improve a specific outcome or group? And the example I came up with is how can access to mental health care resources be improved to better support individuals' mental health? So the specific social issue that I am focused on is access to mental health, and who is it helping improve is individuals' mental health. So the outcome is improving individuals' mental health, and there's not a specific group, it's just anyone who has mental health issues. From my big research question, my central research question, I need to come up with guiding questions. These are the questions that I'm actually going to be searching for answers to help answer that big question. And we covered these different like subcategories of questions in the 3.2 instruction video. So I'm just going to go through and show you some examples of each of these. So some contextual questions, giving context and background, are how have societal views on mental health evolved over time? So how did people used to view mental health, and then how has that changed over time? And how have those historical policies and views contributed to our current state of mental health care access? So there were some pretty narrow-minded policies put in place in the past that have contributed to the way that we see mental health care now, as well as the services that were provided. Stakeholder questions: who is affected and how How are underserved communities particularly affected? So people with limited resources, how are they affected even more than those that have more privilege? And then what are healthcare providers' perspectives on resource limitations? So we have to remember that healthcare providers are people too, and they went into their profession in order to help people. They are limited in their scope of what they can do based on the resources that they have, and I'm sure they have very strong opinions about that. So seeing their perspective might help us understand how to propose a solution. Solution-oriented questions are, what are some successful models from other regions that could be adopted? So maybe there are other parts in Connecticut or other states that have some really effective practices, or maybe there are some things that have been tried in other areas that really haven't worked, and then I can steer clear of those things. How have digital mental health platforms fared in improving access? So that is a solution that's already been put in place. How has that improved access? And then what limitations are there still? And then last are implementation questions. So what would a partnership between like state or national government and private organizations look like? What could a partnership between those two agencies, how could they help? And how can logistical challenges be addressed? So what are the steps that need to go in place in order to solve this problem? What's going to stand in the way? And then how can we address those things? So this is just a model for you to see what a completed this research checkpoint can look like that you can use as a model to guide your planning.